because we want to do something we're doing a lot of stuff for Heart Month coming up, and I thought we'd do something, and I know we did an article not that long ago on heart disease, and I was showing up earlier for younger people in terms of early stage heart disease.
Yeah, heart disease in younger population. Exactly.
But generally, we just thought we'd do something on CAD, and obviously all the basics people can get from our website or from American Heart Association, but I mean, just based on your experience and the latest trends is what I'm always interested in. I think it's best for people's better understanding. So I'll just shoot a couple of questions to you, and then just go ahead and I'm audio recording for my notes, and then I'll send you the article later, so I can transcribe from the recorder, hopefully. And I know people hear coronary artery disease and they hear heart disease, and I guess I know, but let's explain to people what is coronary artery disease as versus like heart disease. What's the best way of explaining to people?
Yeah, that's a good question, and it's a good point of clarification. So, heart disease can refer to a number of things. Colloquially, generally, when people say heart disease, they think of coronary artery disease, which is cholesterol developing atherosclerotic plaque in the arteries of the heart that supplies the muscle of the heart and allows it to function properly. So that's what people generally think of when they say heart disease, and that's what coronary artery disease is. However, it's very important for people to know that there's actually four major systems of the heart. There is the arteries, which can be coronary artery disease. There's the pumping function of the muscle of the heart. There's the function of the valves of the heart that let blood come in and go out properly. And then there's the electricity of the heart. All four of these can individually cause individual problems, or they can overlap and one can lead to a problem in the other. But there's four main problems of the heart. So you can have heart disease in any of those four organ subsystems. But the majority of the time and the most common thing is coronary artery disease, and that's usually what people refer to. But you can have an arrhythmia in the electrical system, and that's still considered heart disease, but it's an electrical issue. Or you could have heart failure from either the pumping function of the valve of the heart being weak by itself, or blockages of the arteries can lead to not enough blood flow in the muscle, which then leads it to be weak and not pump properly as well.
And this is mainly for my clarification. I don't want to get too into the weeds here, but is it more often that CAD leads to the other three?
Yeah.
Okay.
So the most common cause of cardiomyopathy, so a weak heart that doesn't pump well, the most common cause is ischemic cardiomyopathy. Ischemic meaning not enough blood flow, and that's because of the blockages in the arteries supplying that muscular territory.
Right.
But you can still have non-ischemic cardiomyopathy, where the heart muscle is very weak, not due to blockages in the arteries, and there's a whole slew of conditions that cause a non-ischemic cardiomyopathy. Then separate to all of that, you can have a primary valve disorder, where the blood leaks or goes out from a tight orifice, and that can lead to a secondary cardiomyopathy where the heart can't accommodate all that pressure or volume and then becomes weak. So separate. And on the flip side, you can also have valve disease.
Right.
That's secondary to a heart that doesn't work well, that's too big and enlarged, and then you have a secondary valve problem.
Right.
So they all intertwine, and one can cause the other, and another can cause the other, but there's still four separate subsystems within the heart.
Getting back to CAD now I read when you look it up on say CDC or whatever, it says CAD is the most common type of heart disease in the United States. Is that a correct statement? Okay.
That is correct. And like we said, it's the most common cause of heart disease because CAD, atherosclerotic plaque, can cause just primary artery problems, heart attack, angina. And it's also the most common cause of cardiomyopathy, too. So it's the most common cause of heart disease, absolutely.
And for people's knowledge, how is it most commonly diagnosed, CAD?
Coronary artery disease is most commonly diagnosed via either symptoms of angina or chest pain, anginal equivalent, shortness of breath, usually exertional or stress-related, that gets better with rest or with nitroglycerin. That's how it's diagnosed clinically. But definitively, it's diagnosed with some assessment of the coronary anatomy, either with cardiac catheterization, which is definitive and the gold standard, or it can be with a non-invasive assessment of the anatomy, which is with a CAT scan of the coronary arteries.
Now,
a third way that it can be diagnosed is not directly looking at the anatomy, but looking at the blood flow in the heart and to the muscles, and that's with a nuclear stress test, a perfusion imaging, where the patient either runs, does exertion, or gets an injection to simulate exercise, and then a radio tracer is injected, and you see the blood flow in the heart muscle. And there's a differential in blood flow with a healthy artery versus a blocked artery. A blocked artery will have less blood flow, less nuclear radio tracer uptake, whereas the healthy artery will have much more. So on the pictures, you'll see a differential, much more flow and uptake and stronger radioisotope in the good blood vessel territory versus the less blood vessel, and that's how you can diagnose it. But that's a diagnosis based off blood flow, but it's not a diagnosis based off looking directly at the blood vessel, which is done either with cardiac catheterization or CTA.
Now, let's say a person of average, decent health, doesn't have any symptoms, and goes to his checkup or her checkup, is like high cholesterol an early sign? Or
absolutely.
Okay.
So there's it's very important to know that there are many things that can cause atherosclerotic plaque and coronary artery disease. They often work synergistically together, but cholesterol in itself is one risk factor. Then there's a bunch of other risk factors. So overall, what we look at is you have a blood vessel and you have cholesterol going through the blood. Now, if your cholesterol is very high, it'll gradually start to stick to the blood vessels, usually. Or your cholesterol could be normal or even low, and it can still stick to the blood vessels if you have other risk factors that lead to what we call endothelial cell dysfunction and inflammation, but which is fancy term for sticky blood vessels. Blood vessels can become sticky if you have high blood pressure, which interrupts the integrity of the cell-to-cell lining. If you're a smoker, which causes a whole slew of problems. If genetic causes of just sticky blood vessels, that's why some people genetically have heart attacks. Either the blood vessels are sticky or genetically they have high cholesterol. Other causes are diabetes. All that sugar that's going through the blood attacks those blood vessel walls and makes them sticky, so cholesterol can stick. So then with all of that together, and then if you have multiple risk factors, then they work synergistically to increase the amount of cholesterol that sticks and leads to plaque.
So basically, if you have high cholesterol, doesn't mean you have CAD. But if you have other risk factors, then it gets the risk increases, obviously.
Absolutely,
including high blood pressure and like everything else you mentioned.
But there's many people, if you just have high cholesterol, you could still have atherosclerotic disease. But there's many people with high cholesterol who don't. It just depends on what their other risk factors are, how high their cholesterol is, how long it's been going on for, how much exercise they do, their obesity level, how much inflammation is going on in the blood vessels. It all goes together.
Which leads us to the big message we want to get out to people this time, especially with COVID, and to
know your numbers. Know your numbers. Know your cholesterol. Know your sugar control. Know your blood pressure. Know your body mass index. Get that checked every year. So if any of those things are out of the ordinary, on top of that, a doctor will ask about family history, lifestyle, family history of heart disease, and work all of that together and decide together with the patient what the best approach is for their primary preventive strategy to prevent development of heart disease.
And the treatment, and obviously there's meds, but there's also lifestyle, as you just mentioned. We refer to lifestyle changes you can make, health, nutrition, exercise, plus meds. Maybe get you off meds, right? I mean, just to get that message out. Okay.
You basically want to address every single one of those major 8 to 10 risk factors, see what is applicable to the patient, and attack each one individually with lifestyle, diet, exercise, medications if needed to decrease their overall risk.
Do we want to say anything, and we may leave it out, but in terms of COVID and heart disease, is there anything that, I mean, obviously people need to be on the lookout for anything. But
yeah, very important to know. COVID is a very, very stress-provoking, inflammatory-provoking condition where it puts a tremendous amount of stress on the body, also the blood vessels because of that inflammatory reaction. So people who are have heart disease or at risk of heart disease, the chance of them having it become clinically active increases because of that overall stress and inflammatory reaction. So it's not that it causes, coronary artery disease in itself, but the stress of it can increase the stress on the heart and cause a silent condition or one that hasn't surfaced to come out.
Fantastic. And I guess CAD, is that one of the underlying health conditions that people are saying it maybe put you at higher risk for illness from severe illness from COVID?
So
is that
it is CAD. It doesn't put you at higher risk for getting COVID, but if you have coronary disease and the stress of a COVID reaction puts your coronary disease at higher risk of becoming active and unstable.
Okay. And is there, just to wrap it up, is there anything else, any biggest misconception people may have about CAD? Or anything that you want to clear up, just to wrap it up?
If you don't have any conditions, it doesn't mean that you're not at risk of getting it, and it doesn't mean you're not developing it as we speak. So it's important to have all of these numbers known, and a doctor seeing and working with the doctor to make sure you stay healthy. And one of the biggest messages I want to give is, just because your cholesterol levels are normal, quote unquote, just because your cholesterol blood level is read as normal, it does not mean that you cannot develop cholesterol plaque and heart disease. That's just one aspect of the development of ASCVD.
Great point. I mean, that is a great point. I will stress that because I think people in their heads they think of CAD and is that cholesterol? Is that? I think for people with normal people.
With normal, quote unquote, normal cholesterol, where it's not read on the Quest lab form, have heart disease for the first time or second time. And their cholesterol was normal because that's just one aspect.
Right.
Your cholesterol can be normal, but if your blood vessels are sticky, that normal cholesterol is going to stick.
Right. Fantastic. I think I got plenty. Hopefully sometime next week. We're like crazy busy as you are probably. I'll send you some rough draft and then we'll take it from there. And Doctor, once again, appreciate it. We'll talk soon.
No. Great. No, thank you. I appreciate you thinking of me. I'm available anytime.
Take care. Thank you. Take care.
Okay.
Bye.
Stay safe.